So I think that cultural change in the NHS is a tough one because it's such a big organisation, and actually it's not one organisation. I think culturally, if you want to change the adoption of new technologies, the biggest thing you can do is to actually change the attitude of healthcare professionals to those digital technologies. So at the moment, because there's not the confidence in the digital technologies, healthcare professionals can't recommend it to the patients, and also commissioners can't actually spend public money on buying those to solve health problems in their local communities. So if you could deal with that confidence in healthcare professionals, that I think would drive a change in attitude to the digital technologies and would increase the uptake of those digital services. Starting with, can it be achieved? I think the answer is yes, it can be achieved, but it's different than saying I think it will be achieved. My honest feeling at the moment is there isn't that sense of everyone pulling in the same direction. So I think the capability is in the NHS, but at the moment there's too much pulling in different directions. I think the biggest issue at the moment is actually the time and money to allow transformation to take place. So at the moment, people are fully employed with their day jobs and evolutionary change is happening, but transformation requires time and budget, and that's what I think the biggest issue is. So I think that the focus, lots of things could ultimately be transformational, but I think the focus should be on improving current patients' experience of the NHS as it is now. So don't worry too much about the clever technology that's going to, the smartphone app that's going to transform my health. Actually look at how can you make my experience of the NHS better, because if you do that, there'll be really quick adoption, and that will improve my experience of the NHS, but also the costs associated with serving me as a patient. Once the costs are reduced, that frees up money and time to enable further transformation to happen. So one of the most significant projects we've been involved in the last 12 months is actually helping the National Information Board service, where they are building an assessed set of NHS apps. And the purpose of a KiteMart set of apps is to help build confidence in apps with healthcare professionals and to ultimately lead to a digital prescription. So the idea that a healthcare professional can recommend and pay for a digital prescription. So I think in terms of innovation, actually creating a centralised library of assessed apps is actually going to help with that clinician confidence aspect. So from my perspective, it's really interesting to hear people who are doing things completely differently. So there's lots of examples of stuff happening, people changing the way it's done, but here you get to hear people who have actually gone a different direction, and sometimes that alters your perspective about what is possible. So seeing people who have made massive changes in a short period of time enables me to step back and say, actually, do you know what? There is a transformation that's possible here, not just an evolution. So hearing those stories, hearing what's worked and what hasn't, is really valuable to me, and it's valuable because I'll bring that to my clients.